want to be the type of nurse that made you feel safe and the type of nurse that comforted you and allowed you to see that the picture might be scary, but that you're not going to be alone. I'm Marissa Price. I'm a registered nurse here at the Medical Intensive Care Unit at Loyola Medicine. My father passed away of an out-of-hospital cardiac arrest when I was 16, and I was the first person who came home and found him, and I called 911 and had the paramedics and then the emergency department. And I remember through that whole situation just feeling like that I could breathe because those people knew what they were doing. And my father unfortunately passed away, and I remember after that moment sitting and thinking that I want to do that. I want to give someone 10 minutes to breathe on the worst day of your life. And if that's all I do for the rest of my life, then I will be happy. I have a previous career, so I worked as a firefighter paramedic and was exposed to nursing through that aspect. I do still work part-time as a firefighter paramedic. It's super rewarding. It's something that I fell in love with. It's definitely a field there's not a lot of women in, and so I do love that aspect of being able to inspire other young women that just because it looks big and scary or there's not a lot of you that look like you in it, that you can be successful and make an impact regardless. I truly feel like when you walk through the doors in the MICU, you and the docs and the respiratory therapists, you're all one team working together. I have never felt like just a nurse. Those docs have taken my word and we have worked together to fix a problem, and it has made me feel more empowered, and I feel like I learn every day that I'm working. I think the hardest days is to see families struggling with where I was, that feeling of being alone and someone not understanding where they're coming from or the feelings that they're dealing with. And I think it's so hard sometimes to separate the humanity out of it, right? Because as nurses, like, I care for you as a nurse on a medical standpoint, but I care for you as a person. We all take patients home, we all take families home. So I think that makes it to be pretty tough sometimes. As nurses, we're kind of in an interesting predicament within society, and I think it's easy to get burnt out, and it's easy to not prioritize yourself. And I think that it's important on those really hard days to sit down and remember what drew you to nursing and what were those exciting things you were thinking about the first day you put that uniform on. Loyola is truly my family, and I wouldn't want to work anywhere else than be here.